Headaches in kids is real and can be debilitating. Kids miss school, kids miss after-school activities. So let's talk about headaches as migraine and not migraine. Episodic headache is migraine for the most part. With migraine, there's nausea, light and sound sensitivity, and a need to go lay down in a dark, quiet place. Now, if that happens once in a while, treatment is pretty straightforward. There are medicines to take early in the headache. If it becomes more often and school is missed or work is missed and it becomes more of a burden to the child or the family, then other interventions are important. So first thing we do is establish the diagnosis. So if the headache is broken up by days that are fine in between, then it's probably migraine if they have what's called autonomic symptoms. Autonomic symptoms are nausea, vomiting, light and sound sensitivity. My first job is to figure out if it's migraine or not. So we do that first. The next thing we do is figure out how much of an impact that child's headaches have on themselves and family. And we do that in a lot of different ways. And then we tailor a plan based on what I hear back. Now, if people have headaches every day, that's not migraine anymore, and that's more serious in its impact. If someone has headaches once in a while, that's usually not as devastating as someone who's having headaches every day. So the first thing is make the right diagnosis. Is it migraine or not? If it's migraine, more important than medicine is people need to take good care of themselves. They need to eat breakfast every day. They need to drink lots of water. They need to keep their sleep regular even on the weekends, and they need to exercise. So that's more important than which medicine to pick over the counter, because often getting that right will have you have less headaches. Okay, if we've established that it's migraine, the next thing is to talk about treating the headaches right away. If you can treat a headache at first twinge, almost everything works. Over-the-counter medicines work, prescriptions medicines work fine. However, if you have a migraine and you've let it go because you don't have medicine at school, or you waited and hoped it would go away, hardly anything works. So the most important thing I can teach parents and school people is have people have whatever medicine works on them or at school, and it's like a forest fire. You want to catch it before the whole forest is on fire. You want to catch the ember right away. Same with treating headache. So it's not as important as which medicine to pick. It's that you give the medicine early. Migraine, again, is episodic. It makes you stop what you're doing. And there are autonomic symptoms: nausea, vomiting, light, sound sensitivity. It doesn't matter if the pain is in the front, if it's down here, if it's in the neck, if it's one side or both sides. It's still migraine if it meets those criteria. So when people say there's no such thing as migraine, if somebody has a headache that makes them stop what they're doing and go lay down, it's a migraine.